This is Chapter 8 on patient reception and ergonomic practice. So the patient reception and practices are that before they even come in, we're going to prepare for the patient. We're going to disinfect the treatment area. We're going to look at the records in the computer from their previous appointment. If they are a returning patient, we're going to gather any kind of paperwork that we may need, extra pen for the patient to sign anything with if it's a new patient. So we go to the reception area, we introduce ourselves, and escort them back to our chair. So the positions, we want them upright when we're talking to them. We want them eye to eye when we are updating their chart or talking to them in any way with the medical history and before we give vitals. So we have an upright position, a semi-supine position, a supine position, and the Trendelenburg. So semi-supine is half up and half down, kind of somewhere in the middle. It's usually for respiratory, congestive heart failure patients, people with vertigo issues, or maybe even just dizziness. It could also be for someone who has a bad back and doesn't want to be laid all the way back. So then we have the supine, which is flat. Your brain is at the same level as the heart, which is going to support circulation. Lastly, we have the Trendelenburg. This is where your head is lower than the heart and feet. This is used as you hopefully already know in the emergency of syncope, which is fainting. The patient may already be supine, and if they faint, then we're just going to tip the head just a little bit down. We don't want them rolling off of the chair, but we do want their head lower than their heart and their feet so that the blood can rush to the head and they'll come to a little faster. So here are some the positions. This Trendelenburg, the head is a little further down than you really actually need to put it. We don't want it, like I say, sliding off, but it needs to be further down than the heart and the feet. So pre-positioning for the reception, you want, before your patient comes, you want the chair down. You want the chair down at a low level. You want the back upright. You want the arm raised so that they can easily slip into the chair. So once they're in the chair and you are making the chair go in a supine position and flattening them out, once they get down there, a lot of times you want them to slide their head up to the top of the chair so that their back is fitting where it needs to fit and be the most comfortable and support circulation. Their head should be, their oral cavity should be right at your elbow. So if you have it further up, which clinicians have a tendency to do when they're brand new because they're afraid they're not going to see everything in the oral cavity. But when you do that, your arms or everything is going to be in an upward motion and does not support ergonomics. So we want their oral cavity at about elbow length or elbow height. So at the conclusion of the appointment, you want to slowly raise them to avoid postural hypotension, but most of the chairs have a mind of their own. When you push a button, it's going to go in at a certain speed automatically. So you just need to allow your patient, tell your patient that that's what's happening, that you don't have control of how fast it goes up. So you're going to have them sit there for a few minutes just so that they can get their balance and equilibrium back. So contraindications for supine position, as I said, would be those that are listed right there. It might also be asthma, anybody with a breathing difficulty, or possibly third trimester pregnancy. Sometimes they have a hard time going all the way back. So I'll let you go ahead and go through these reviews. So you'll need to know this. You can see that this particular clinician has on a pair of loupes, which are magnified glasses. And with that magnification, you can see that the posture is really good. It's where it needs to be. The top of the chair, that chair back is fitting right in the small of the back. The buttocks is scoot all the way back so that you can align your spine perfectly down. This clinician is just moving her head down. She's not hunching forward from the waist. She is straight up and down and just moving her head down. 15 to 22 inches should be somewhere in that range, depending on if you're shorter or taller, is where a good range that you will need to know. You'll need to know that number for future tests and midterms, finals, and possibly boards. So you can see that on a normal chair, that's the typical sitting position for us, especially if we don't have loupes, where our back is hunched over. And they have new chairs now, some like these certain types of chairs where you can see the spine is aligned. I've not tried those. I have heard good things about them, but have not tried them. So the working posture, you always want to be in a neutral position. If any test question is ever going to ask you what position is best for your hands, your wrists, your person, your body, you're always going to choose neutral, because that is the position that we want. You want a good light access and good visibility. So you position the patient's position for a short time in your chair. So if they are lying in hopefully they will tell you if they're not comfortable. A lot of times they won't tell you, but regardless, they're in that position for a short amount of time. In our clinic, it's a little longer because of the nature of the time slots in our clinic. But in private practice, they're in that chair for maybe 45 to 50 minutes, maybe up to an hour at the most. But you will be, as the clinician, being those positions 8 hours a day. And in our clinic, it will be 3 to 4, 5 hours, maybe sometimes 6 hours that we will be sitting. So it's really imperative that we try to keep good posture. By keeping a working neutral position, we reduce overexertion and injury from mental and physical stress and fatigue, and it also provides for patient comfort. It's the single most powerful tool the clinician has to reduce the risk of injury. So your elbows should be close to the body, your forearms parallel with the floor, wrist and forearms in a straight line, thighs full body weight distributed evenly, and 3 inches between the edge of the seat and the back of the knee. Your feet need to be flat, no crossing at the ankles or crossing your legs. Your feet need to be flat on the floor for really good posture. So you can, once again, answer these review questions. Patient positions, distance, once again, I will tell you eye to oral cavity is 15 to 22 inches. We position ourselves, the clinician, on the basis of clock hours. And so 12 o'clock would be if you're sitting right behind the patient's head. And if you're right-handed or left-handed, you would be going at those particular clock times. This is going to show you a better picture to get so that you can see if you're left-handed. You're going to sit in front of the patient this way, and that would be at about 4:30. If you're sitting straight like this, it's going to be 3 o'clock. And we sit kind of right in between, right in back of the patient's head, and this side will sit at 1 or 2 o'clock to do some scaling, and at 12 o'clock. So if you are right-handed, you're going to be sitting in front of the patient to do some teeth and do some procedures, and that's going to be at 7:30. And then straight sideways to the patient is 9 o'clock. You might be sitting somewhere between 10 and 11, probably mostly 11. It's right at the curve here of the chair is somewhere where you're going to want to be, and certainly at 12 o'clock, right behind on both sides. So our work area is going to center around our patient's oral cavity. That's our entire treatment area. And the actual work area refers to the dental chair, the unit, and our instrument tray. And with light access, it would be the lighting above needs to be at a certain position for us to be able to see the best, and when you get loops. So an acceptable stool, I've seen this in review books, if you can believe it, but a base, you need a base with 4 or 5 casters. It needs to be broad and wide. The seat needs to be seamless and padded. It needs to be seamless to cut down on with infection issues. Height should be adjustable because we're all a different height. And the back of the chair is adjustable for lumbar support. You can tip the back kind of forward if you need that. It needs to be mobile. You need to be able to make adjustments and infection control friendly. The lighting, the dental light features, you need to have your overhead light within your arm's reach. Don't push it all the way to the back when you're finished using it, because you will just wind up having to crawl practically over the patient to get it again. So you want it at arm's reach when you're using it or not using it. So it's readily adjustable both vertically and horizontally. So here is where you want your mirror for the maxillary. You don't have it straight up and down. You have it kind of in front of the patient's head, and you angle it so that there's this angle coming this way. And then you can see the teeth a little bit better. You can see here on the chair that they've moved the head just up just a slight bit. And for the mandibular, you want the light really overhead. You want it directly overhead and shining right into the patient's mouth, and you'll have better visibility. These are loops. For those of you who have not been in the dental industry, they also have lights on them. Like you can see this picture of the guy that has the light also, so that you can see. That way you don't have to use the overhead light. And these lights usually have from dim, and they will go to super bright. They have a different range that you can use. So ergonomic considerations, you want your handpiece, the designs, your handpiece should be light and small. You don't want anything large and heavy for ergonomics as far as tiring you out, and as far as being able to hold it and use it without, with less issues that might happen to the patient's mouth. If you've got something that's real heavy, you're more likely to possibly be kind of banging it around. If it's light, you can control it a little better. The cords, we don't like to drag the cords on the floor. There's one big, huge cord that is on the floor, but and needs to be with the high back. But your other cords, you should put your unit up a little bit so that they're not on the floor. Instrument handle size, we'll talk about that. The larger diameter instruments are much more ergonomically correct. The instruments that you have in your Hu-Friedy instruments are awesome. They are light, they're in diameter, they're wide, they have texture on them for a better grip, and that's all to the clinician's advantage. These are the different diameters. When I was in first in hygiene, we had mostly these sizes right here. And they're real skinny. This was with no texture. This first one was with no texture and could slip easily. And so they started making them with texture on them for a better grip. And then they made them just a little bit wider, and that was better on our hands and better control. Then they started realizing that if they made them much bigger, which this is what we have today, these two at the end, that it was much better. Even this one right here is okay. It just is going to show you the different types of texture that they will have, but they're super light. They're making them out of lighter material, and you have much more control and a really nice grip. So the issues that we can have are musculoskeletal disorders, and that are related to our occupation. It's from prolonged awkward sitting, your arms being raised higher. Maybe you don't have their oral cavity at the height of your elbow. You have the chair up a little bit so that your elbows are kind of flailing outward when you're scaling. So that's a no-no. Holding positions for long periods of time, bending your neck in a wrong way, repetition, repetitive. This is a repetitive occupation, and so we need to do what we can to protect ourselves the best we can. The force and the grasp should be light, and it should be forceful enough of a grasp that you're not going to let it fall out of your fingers, but we need to keep it really light and don't have a death grip on that instrument. Maybe you have insufficient rest, and this is a career where there's a lot of insufficient rest. You're usually going all day long until lunchtime, and then you get your rest. So you can have like a 3 or 4 hour period to where you're not really getting much rest. Maybe there's a lot of stress in your office, and maybe you're not in the best physical fitness shape that you could be in. So the self-care for the dental hygienist, what they want you to be able to do is take adequate breaks and be in good physical condition. So there are, since we rarely can take a break in between each patient that we have in the office, there are some things that hand exercises that you can do that are in the book, and we'll probably show you a picture of them in the next couple of slides. And if you can even do a few of those with your neck, in between patients, or while you're waiting for what the doctor's doing his exam or something, that would be really good. This is what we're talking about in carpal tunnel. You can see where you have this muscle, you have this median nerve here that runs right below, and this into the thumb area is where, and the fingers is where this can get squeezed. So if your hand and wrist are in a neutral position and just straight, and your wrist is not cocked, like upward, hand going up or down from your wrist, then it's the best. You have the best circulation, as you well can see. But when it's cocked, you can see this other picture here where it has the ligament that is holding this nerve is on. When this is bent for long periods of time, it can become inflamed. And as it becomes inflamed, it pushes against that median nerve. And that's what can give you nerve issues. And also, when your wrist is cocked up or down, you can see how it's going to be cutting off the circulation a little bit to those areas. So there are reasons that we say neutral positions for everything as much as possible. So your daily functional movement exercises, you want to constantly pay attention to how your spine is and having a healthy spine, and hand exercises. These are the exercises I was talking about. Sometimes in your chair, you can at least put your arms up and move them from side to side, maybe stretch your neck, roll your shoulders, one up and one down, as in here, right here, as you are waiting at some point for a patient to come in or to come back from the restroom or whatever. You could stand up and go up on your, lift your heels up. And these are hand exercises that prove to be really good for your hands, that you can do kind of behind the patient's head at different times of your appointment. So sometimes your patient will want to be positioned in a certain way, but they have no issues. They don't have a back issue. They don't have a breathing issue, but they will try to dictate where where the chair height will be. And so a lot of, or if they're going to move their head to the right or the left, the patient can help us out a lot here by, if we just will say, can you move to the right? Can you move your head to the left? They'll easily do that with no issue, but a lot of times new hygienists will try to work in the position, whatever position that the patient is presenting themselves in. And so we'll be twisting and twerking our body to try to fit where they're opening their mouth. If they're looking, straight up, or they're a little to the left or a little to the right. So all you have to do is just ask them. And when they want to move in a different position, because maybe you, for like no reason at all, you could say, well, I can see better this way. And if they know, there's a reason that you are positioning them all around. Usually these are with extremely high control freaks. Usually there's no issue. So it's going to benefit them. It's going to benefit you. And so that is the end of this chapter.